Welcome to the new talk show, Health Matters, with your lovely host, Ugonna Anosikei. On this show, we will be interviewing doctors, pharmacists, nurse practitioners, dietitians, and many other health professionals. Catch us at 4 p.m. on Saturdays on ABN TV, channel 15.9. Thanks for watching. Hello, and welcome to Health Matters. I am your lovely host, Ugonna Anosikei, and today I have the lovely Dr. Linda Uhegwu, and we will be discussing diabetes. Great. So, you're the expert, but I want you to start telling us what we're going to be learning. But first, can you say hello to the people that are watching?
Of course, no problem. Hi, everyone. Thank you for inviting me to Health Matters.
You're welcome. I'm so happy to have you here today. I know you're going to help us out a lot. Okay, so let's start with, what is diabetes?
Well, definitely. I want to jump right into discussing everything about diabetes.
Okay.
But I think we need to understand ourselves a little bit better.
Okay.
And the way to do that is to understand how the body actually works. The body is a beautiful thing. And to be very honest, I think you've heard the term, the body has a mind of its own.
I've never heard that term before.
Well, the body does things that you are not even aware of, just to keep functioning on a day-to-day basis. And one of the things that the body does is that it breaks down the foods that we eat and it makes it into sugar. And so that's our digestive system. We eat something, it goes into our body, it gets broken down. And so what I'm referring to is you eat carbohydrates, maybe like bread, pasta, or rice. Your body breaks it down into sugar.
Really?
And then your body will also now produce what we call insulin. Now, insulin is produced primarily by what we call the pancreas. It's an organ right in the middle of the abdomen.
I'm sorry, you said insulin. You know, I always hear diabetic patients talk about taking insulin. So your body actually produces the insulin?
Everyone's body should already produce insulin, as even a child. So your body produces insulin. The sugar that is already broken down in the body, the insulin now goes and puts it into the cell. And so if you think about it, your body produces the key, which is insulin, to unlock the cell to let sugar inside.
That is so interesting.
So if you think about it that way, then if you don't have insulin, that means you don't have the key to open up the cell. And then sugar has nowhere to go.
Okay.
So that in essence is diabetes. It's when your sugar cannot enter the cell and the body cannot use it anymore. And the sugar is so important because it helps each individual cell to function and to continue your daily activities day after day. It helps the brain to think and be aware of everything. So sugar is very important, but not just in the body. It has to be in the cell directly.
So let me try to understand. So are you saying that diabetes is the lack of the production of insulin in your body?
Diabetes is the lack of the body's ability to use sugar.
So the lack of the body's ability to use sugar.
Because there are different types of, diabetes.
Okay.
And so when I say, it's not just a production thing. Sometimes the cells are resistant to the insulin. Sometimes your body doesn't produce enough insulin, but it does produce insulin.
Okay.
And sometimes your body attacks the insulin, so you are not producing anything. So there are different ways of describing, diabetes, or describing, not having enough insulin. But if you want to categorize it, we really look at diabetes in two main ways when we talk about diabetes. Type 1 and type 2.
Okay.
Now, we used to call it insulin dependent and then insulin independent.
Okay.
But we're crossing barriers now because people who did not need insulin before are now needing insulin. So we call it type 1, and we see it manifest in younger patients And we see it manifest because these particular patients, they don't produce insulin.
At all.
They don't produce it at all. Either their body doesn't produce it,
Mhm.
or their body has attacked the pancreas,
Mhm.
and so they're not able to produce it anymore. So you see it manifest at a younger age,
Mhm.
and that's what we call type 1. And so because there's no insulin in their system, they need to have insulin all the time.
Okay.
So they always need to have insulin injected.
Okay.
Now, type 2 is different in a sense that we usually see it because the body is not producing enough insulin, meaning you eat too much sugar and your body is producing the normal amount that it has produced before, but it is not enough to bring into the cell all the sugar that is produced. So you need a little bit more help. Either you need to promote the body to make more insulin, and you can do that with pills, certain pills for diabetes.
Okay.
Or you can actually do it with insulin. So that's why we don't call it insulin independent, because you may require insulin with that. And there's another type, usually we see it in pregnant women, and we call it gestational diabetes.
Okay.
And we see it primarily in women who have high sugars, they are not producing enough insulin. Granted, they have a baby growing, so that baby also needs insulin. And so in order to protect the baby and the mother, they usually will go on insulin in order to protect them, because the sugar that stores up can cause the baby to grow pretty big. And we're talking about like a 9-pound baby.
Ooh.
That's a big baby.
In her stomach.
Yes. So
Wow.
that's a big baby. And if it's not very well controlled, the mom at some point, either right after or further down the line, can end up having regular diabetes.
Oh my goodness.
So it's something that we really try to keep it under control as much as possible. But distinguishing the types is important sometimes, because it helps us as a clinician to understand the types of medication we can use, the types of changes we can make, and really try to help control the diabetes in anyone.
Okay. Question. So there's type 1 and type 2. I've also heard people refer to diabetes as adult onset. Which one would that be?
That would fall more likely into the category of type 2.
Okay.
But that doesn't mean you don't have outliers. There's no absolutes, right?
Okay.
So you can still have type 1 as an older person, but that is not so common. Most times, usually, we see type 1 in the age population less than 30 years of age. That's when we see type 1 diabetes. So the adult onset usually is after the age of 30. So that's kind of how we can differentiate it by age, whether you need insulin or what is actually happening in the body to determine what you need to use.
Okay, good. So, what causes diabetes? I know that diet has a huge part to play in it. I'm sure exercise as well. So are those the type of things that will cause diabetes?
So I mentioned earlier, there are several things that can cause diabetes. One can say, I am the only one in my family that has diabetes and I don't know why I have it. You know, other people can say, everyone in my family has diabetes and here I have diabetes. Sometimes it can be genetic, so it can be passed down from your parents, grandparents, and so forth. Sometimes it's just unfortunate the body attacks its own insulin. So it attacks the cells that make insulin, and then you don't have enough insulin. So that's what we call, your body is attacking its own immune system. So it's an autoimmune disease, and that's a potential cause too.
I'm sorry, if it's the autoimmune disease, that means there's no prevention? Or?
Well, it depends on how much of an attack it is. So sometimes your body, let's say you have a virus, and this virus is recognized and is very similar to the cells that make insulin. And your body wants to fight that virus, and it fights the virus, it kills the virus, but then it recognizes a pattern that is very similar. It can also attack those cells. So if it attacks the cells and says, oh wait, these are our friends, these are our body, it can stop.
Okay.
But if the body continues to attack its own cells, yeah, you can end up, not producing insulin at all. And sometimes, over time, you've produced so much insulin, you eat a lot of sugar and eat a lot of carbohydrates, your body's like, whew, I am tired.
Yeah.
And so sometimes you get burned out. Sometimes the pancreas burns out because it is tired and it cannot make enough insulin for the amount that you're eating. Now, if you think about obesity, is that an overeating issue? It can be, but it's the type of foods that you're eating. So if you're eating an excessive, and this is what I mean by excessive, you're indulging in more than what is normally needed for your daily function, then you can start adding weight. And you start adding and adding and adding. And as you continue to add more and more, your body still has to produce insulin over and over and over again. So over time, your body can say, what would have been the amount of insulin produced for 70 years, it's produced it in 35 years because of the excessive amount that we are the modern culture is used to eating. We're used to eating a lot at one time.
And do you think I think it's more prevalent in Western culture. What do you think?
Oh, absolutely. But I don't want to disguise that diabetes is very well known in the Western culture. It affects about 25 million plus children and adults in the U.S. alone.
25 million.
So these are the people that we know of. What about the people that we don't?
Yeah.
There are a lot of undocumented cases of diabetes. And I know you've probably heard stories. Oh, my family relative passed away and we don't know why.
Yeah.
There are times that there are actual conditions that are going on that we are not aware of. We are not diagnosing and we're not putting a name to it.
True.
And sometimes if you allow these things to get out of control, it affects the entire body. And it can even lead to that. So that's why we have to be very mindful that knowing our body and taking our health very seriously and knowing that our health matters to us, we have to be the people who steer our own course and take control of our own health.
Wow.
So, it affects a lot of people, and we just have to keep in mind that these are only the people that we do know about.
That's so true. So true. So, so what are some signs? Because I'm just thinking about, like you mentioned, a lot of us eat recklessly, especially from, childhood. You're used to eating chips for snacks, going to Burger King, McDonald's. Schools, they order pizza, they give ice cream, candy, the piñata. Living in Texas, almost every child has hit the piñata and run to the ground to get the candy. So sometimes I feel like these bad eating habits are started like so young, and it's very hard to break that cycle. And so part of the question is there a buildup of sugar, or just that your organs get so tired from your childhood, so by the time maybe you're in your 30s, everything starts breaking down and the diseases start coming out? And so I guess now that brings it back to the original question, what are the signs?
Well, there are several signs, and we're going to get into that. But to answer your question about the early start, I know growing up in the U.S., my household was very Nigerian.
Yes.
I wasn't allowed to eat certain types of
Okay.
foods. I would go to school and I would want to sneak certain things.
Yeah.
And it's funny because it seems as though my mother already knew the days that this would happen. And she was there somehow.
At school.
At school, kindergarten, first grade. And so my mother at times put a stop to that overindulgence.
Okay.
Or the ability or the capability to be able to overindulge at certain points. And we were not trained on eating a lot of sugar in the very beginning.
Yeah.
Now, did we sneak it? Did we run after it? Yeah, we did.
Mhm.
But those were not our first times of getting sugar. Before, when I was younger, our first signs of having sugar were fruits and different kind of cookies that were sweet but not too sweet. Didn't have sugaring or icing on it. So, you know, parents have a good way of directing their children.
That's key.
We didn't really know about McDonald's until I think I was in maybe middle school, high school.
Oh, wow.
And we knew about it, we could see it, but we weren't allowed
To
to
go.
indulge in it. Because
That's
I
awesome.
remember my mom saying, what do you need to eat that for when we have food at home?
Exactly.
And I'm like,
You eat
but
rice.
it's McDonald's and everybody does it.
Exactly.
But no, she really wanted to steer us in a way
That's good.
that she could control our diet
Mhm.
and didn't know, or maybe didn't know at that time, what she was doing for us.
Mhm.
So as it starts early, prevention also starts early. And it starts from the adults who know. And if you know, take it into your hands.
Mhm.
Make sure your health matters to you, for you, and for your children. Now, to go back to your original question, what are some of the signs and symptoms? Well, there are several of them.
Yeah.
And this is if you have very low blood sugar,
Mhm.
very high blood sugar, type 1, type 2, they kind of run together. So it's not to say that this is absolute for one, but for type 1 diabetes, sometimes the symptoms are a lot more severe.
Okay.
Okay, so one of them, let's talk about them, is you urinate, and you urinate a lot. And you may see that, wow, I'm urinating a lot more frequently. So instead of just urinating once or twice a day like I always have urinated, I'm urinating maybe 5 or 6 times a day. And it's a large
That's a
amount.
lot.
That's a lot of urine.
And it's not because, so even if you're not drinking a lot, you will still urinate 5 or 6 times because it's a symptom of diabetes.
It is a symptom. But with that, your body becomes thirsty. If you think about a sugar, a box of sugar, you pour it in a can, okay? When you put water in it, that sugar is going to concentrate that water. Think about sugar in the body. When the sugar is not able to go into the cell, it stays in the blood. It concentrates the blood to where your body is like, we're dehydrated and we need more fluid. So just with the urination is one aspect. You also become very thirsty, and so thirsty that you're drinking more water than you probably have ever drunk in a very long time. And this becomes a repetitive pattern that you're always thirsty, you have dry mouth, you have, tough skin, or you're always feeling tired because you're so fatigued. These are the signs that come with it. The increase in urination, the increase in your thirst, and also what it also causes you to be very hungry.
Really?
It causes you to be very hungry.
Oh my
And
goodness.
so you end up eating quite a bit, gaining more weight.
Oh, that's so counterproductive.
It is counterproductive, but if you think about it, the sugar is in the body, not in the cell. So what is the cell doing? Telling the body, we need sugar, we need sugar. So you eat more. But there's no insulin to put it in the cell.
Wow.
So it sounds counterproductive, but the body is saying, help us, get sugar into our cell.
That's why.
And so you eat more instead of
Got
less.
it.
Yeah, so it's definitely something that you have to know the physiology of the body, but when you start to understand, you'll get it.
Wow.
You definitely will. So I talked about increased urination. I talked about drinking, your thirst being unquenchable. I talked about eating more. One of the things that people don't notice is, or they notice but they put it off, is blurry vision.
Oh, I've heard of that one.
People with high sugar levels can have more blurry vision where you are able to read the book right in front of you, the newspaper right in front of you, the signs right in front of you, or watch the TV without any problem. Now it's just a little squiggly and a little blurry. And people put that off and say, oh, I'm getting older, my eyes are very tired. Sometimes that is actually a symptom more than just a coincidence. And those are some of the signs that we as clinicians hope and pray that people take in mind that if this is not your normal, then it probably isn't normal. You, yourself, and everyone else, you know what's normal to you. You've been doing the same thing for years.
Yeah.
So if you're urinating more, you're hungry more, and you're drinking more water, and your vision is blurry, I think it's time to really visit a clinician.
So these are all for symptoms of type 1.
No,
So this is type 1 and type 2 diabetes.
type 1 and type 2 diabetes. It's basically either you don't have insulin produced or there's not enough insulin. The key does not unlock the cell
To allow the insulin
to allow the sugar to go into the
the
cell.
cell.
So that's something that you need to understand.
Oh, wow. Okay. Well, that was very informative.
I hope so.
you've told us about what diabetes is, the process, the physiology of the cell, and how the insulin works, and how the pancreas works, and how to differentiate between type 1 diabetes, type 2, gestational diabetes. You've told us about the signs and symptoms, about being thirsty, blurry vision, overeating. So now let's continue. What else can you let us know? So after you feel that you have the symptoms and you go to the doctor, what kind of tests can we look out for so we make sure that we're really getting the correct assessment to treat it?
Well, each clinician, each doctor is going to be a little different in the way that they practice. But usually to test and to confirm diabetes, you need at least 2 positive tests. So that can be a blood test, and one of the blood tests is called the hemoglobin A1C. It's a long word, and basically it tells us the percentage and it tells us the percentage of how high your sugars have been over a course of 3 months.
Oh, wow.
So if your sugars are very high, your percentage is going to be high. And usually we're in the single digits, like, 4 to 7, around there. Now, if you're in the double digits, 10, 11, 12, that means your sugars have been very high for a very long time.
Oh, wow.
And so automatically in our brains, we may not even do the secondary test, but we may do it for completion's sake, but that may gear us into the direction of saying we need to go ahead and start treating. Okay? The other test, other than just the standard regular blood test, is another blood test that we do, but it's a fasting plasma glucose test. That's a long word to say we want you to not eat for 8 hours.
Oh, okay.
Yeah. And then we want you to come into the clinic and we're going to draw your blood.
Okay. So you fast for 8 hours, then you go in for a blood work.
Exactly.
Okay.
And when you come in, we're going to test your sugar at that time. We're going to test the amount of sugar in your blood. So it's not always that you have diabetes. Someone may have a sugar level that's in between around 100 and 125. That is what we call prediabetes. That means you're likely at risk of developing diabetes. So we now implement the plan to help hopefully prevent you from developing diabetes, which is what everybody doesn't want.
Yes.
Okay. So if you are greater than 126, if your sugar is greater than 126, and you have another test that says yes, you have diabetes, generally we're going to diagnose you with diabetes. Okay. And with that being said, we decide as a practitioner what would be the best course of treatment options for you. Some people are just at the cusp, barely getting into the diabetes range. We can work with that, and we can try to get you and keep you off of medication. And that's a possibility.
I was going to ask that.
Yeah. Now, that means that you have to take your health into your own hands and be very thorough and be very diligent about what you're doing. But, there are people who have the diagnosis of diabetes but are not on medication for it. And they manage it, they change their diet, they change several things about their livelihood. And that actually affects their diet, so their diabetes.
Okay, I'm sorry. So, question. I know that when you are diagnosed with a serious illness like diabetes, the management with your medicine is very important. But
Yes.
It can be life and death, right?
It
A
can.
matter of life and death. If you get off of your meds, maybe a week or so you don't take your meds, could it send you to the hospital?
Oh, absolutely. And so you have to really put into perspective. Not everybody will go to the hospital. Not everybody will know the signs, right? And even for the people that have every sign, they still may not go get checked out.
Okay.
So diabetes may actually be in your body. You may actually have resistance to insulin or not enough insulin, and your sugars are very high, and you don't realize anything is wrong, or you don't want to realize anything is wrong. It's a denial thing too. And so you can go a long time with having diabetes, but that does not mean it's not causing harm to organs or body parts. It is still playing its role. It is still affecting the body. And I think that's the problem, is that if we can get it early, if we can diagnose early, we have better strength of going after it and managing it. And as your practitioner, we want to be hands-on. We want to make sure that your plan may not be this person's plan, but everybody has a plan that is geared to helping them out.
Okay, good. So we learned a lot. We'll talk about more in the future. I really appreciate you coming today, and I'm sure we all learned a lot. Number one, we need to make sure that we stay healthy with our diet.
Absolutely.
And go to the doctor when you see the signs and symptoms.
Absolutely.
Thank you for joining us today with Health Matters. I want to thank you again, Dr. Ohegu, for all of your knowledge. And we will see you at the next episode. Thank you and goodbye.
Bye.